Can a diabetic patient take milk? And if he or she can take milk, what is the best option? Hi everyone, this is AY the Diabetes Doctor. I'm a doctor and a specialist on diabetes. One of my followers that has been watching all my videos requested that I do a video on the best option for diabetic patient in terms of milk. So today we are going to discuss if a diabetic patient is allowed to take milk, and if that's the case, what is the best option for a diabetic patient. So if you want similar videos to be done for you, kindly write on the comment the video you want, the aspect of diabetes that you want that discussion to be about. So but let's go ahead with today's discussion. For us to understand if a diabetes patient can take milk, we need to understand what is milk and what are the components of milk. So milk is a liquid. It's a whitish liquid produced by the mammary gland of animals. And the sole purpose of milk initially was to feed the young of such animals. But over the years, thousands of years, humans have understood that there is a lot of nutritional benefit from milk. So milk is a highly nutritious liquid. So what are the components of milk that makes it highly nutritious? So milk has carbohydrate, it has protein, it has fats, it has a lot of vitamins such as vitamin B12, vitamin B6. It has some of the most important minerals such as zinc, such as selenium. So you agree with me that milk is highly nutritious because the carbohydrate in milk provides energy. The protein in milk is needed to build the muscle and also other functioning of the body. The fat in milk is required for the production of hormones, especially reproductive system hormones. Then the zinc is required for the immune system. The vitamin B12 is needed for the production of blood cells. The selenium is very important for the production of reproductive system hormones such as testosterone. You know that without testosterone, a man cannot be a man. So you can see that milk has some of the most important nutrients that humans need. So what are the various types of milk? The most common milk that we see in this part of the world, in Africa, is cow milk. And cow milk has all these nutrients that I listed. So it has carbohydrate, which is almost about 12 grams. So if you take a cup of cow milk, it has 12 grams of carbohydrate, it has 8 grams of protein, and it has 8 grams of fat, together with all the vitamins and minerals. So cow milk that has not been modified is referred to as whole milk. So whole milk is one of the most common milk that we find around. Apart from whole milk, you have reduced fat milk. So the fat in reduced fat milk is about 4.5 grams, which is lower than that of whole milk, which I stated earlier is about 8 grams. Then after that, you have low fat milk. So the low fat milk or partially skimmed milk, by the way, skimmed means that there is low amount of saturated fat. So you have low fat milk. The low fat milk has about 2.5 grams of fat. So you can see it's far lower than the whole milk, which is 8 grams. So after that, you have the fat-free milk. So the fat-free milk has no fat or negligible amount of fat, but it has all the other components such as the carbohydrate, the protein, the minerals, and the vitamins. After that, you have the lactose-free milk. So, but for us to understand the purpose of lactose-free milk, we need to understand the concept of lactose intolerance. So certain individuals have deficiency of a hormone lactase. And the role of lactase is to digest the carbohydrate in milk, which is mainly lactose. So some individuals that have this deficiency tend to have lactose intolerance, where whenever they take milk, they have abdominal discomfort, they have diarrhea, and also other symptoms. So the lactose-free milk is to make sure that those who have lactase deficiency, which leads to lactose intolerance, can take milk. But some individuals that are vegans or certain health condition makes it difficult for them to take cow milk and other modified form of cow milk. They can take plant alternatives. So there are plant alternatives to milk. One of them is oat milk. So when you blend oat with water and sieve it, you have oat milk. So oat milk has less amount of protein compared to cow milk, but has higher amount of carbohydrate. Though that amount of carbohydrate may not cause problem because it has fiber. And the role of fiber in any diet is to limit the spike in blood glucose. So you can see though oat milk has higher amount of carbohydrate, it may not spike the blood glucose, and it has less amount of fat. Another plant alternative to milk is soya milk. Soya milk has also good amount of protein, less amount of fat, and less amount of carbohydrate. Then you have almond milk. Almond milk has the least amount of carbohydrate in it, and it has vitamin E, which is an antioxidant, and it also helps the skin. Then you have coconut milk. One thing you should know about coconut milk is that it has no protein. So if you are seeking for protein, coconut milk might not be your best option, but it has carbohydrates and also has lower amount of fats. So with this explanation, what do you think would be the best type of milk for diabetes patient? So it depends on certain factors. It depends if you're taking the milk as a meal, or you're taking it as part of your snack, or you are taking it for other purposes. So if you're taking the milk as part of your main meal, you can once in a while take a cup of whole milk because it provides you adequate diet because it has carbohydrate, protein, fats, and minerals. But as a diabetic patient, because of the high amount of fat, you cannot take that whole milk regularly. Then the partially skimmed milk is very good for diabetes patients. Why? Because it has lower amount of fats. And you know, diabetes patients are at risk of developing high level of cholesterol. So the low fat milk is a very good option for diabetes patients. But however, you should know that it still has high amount of carbohydrate of about 12 grams in a glass cup of milk. Then you have the skimmed milk, the one that doesn't have fat at all, which is also a very good option for diabetes patients. Though majority of my patients find it difficult to take that because it has little or no taste. However, it is very good for people with diabetes. But if you are looking towards lowering your blood glucose, then you should target the plant alternatives because they have lower amount of carbohydrates, especially the almond milk. It has the least amount of carbohydrate and has some protein and fat. So it would be good for you to take it in between meals as part of your snack because you have no fear that it will spike your blood glucose level. So generally, my advice is the best milk for a diabetic patient, it depends on what you're looking for. The best milk for diabetic patient to ensure there's no blood glucose spike is almond milk. But if you're taking this milk as part of a main meal, not as part of your snack, you can take whole milk once in a while, but the skimmed milk, that's the fat-free milk, is the best option for animal sources of milk. But for the milk that you go to the supermarket to buy, always look at the label. What are you looking for? You're looking for the amount of carbohydrate, you're looking for the amount of saturated fat, and you're looking amount of protein. You should make sure that the amount of carbohydrate is low, and there should be little or no saturated fat. So with this, I believe you have an understanding that the diabetic patient can take milk. He can take whole milk once in a while. He can take skimmed milk more regularly. But the best option for a milk that will not spike the blood glucose is almond milk. Thank you.